Welcome, everyone. My name is Casey Craig, and I'm the Executive Director for the Acute Syndrome Foundation. But most importantly, I am the mother to Stella and Lincoln. And Stella is my SCNAA warrior. And today we have two amazing people with us. So we have Jennifer Seidman, and then we have Maria Hofgarten. How'd I do?
You did great.
We were practicing
Oh,
beforehand.
yeah.
And both of these lovely ladies are from the Courageous Parents Network. And if you happen to be in our previous segment, Decisions, Decisions, and More Decisions, Jennifer was with us, and it was wonderful. You know, some of those things, when we sit and look at it, I'm like, oh, that seems like common sense. Why didn't I think about, the decision fatigue and the anticipatory regret and things like that? But once you started talking about it, I'm like, this makes total sense. So if you're like, I have no idea what they're talking about, make sure you guys go back to our last episode. It's already on the TCSF website, so you can see that recording. But today we're going to talk about something that can be a little, I don't want to say touchy, but anxiety. Driving that anxiety that we already have. It can be fearful, it can be scary. It's something that I know, particularly in our family, like we tried to avoid because we're like, we don't want to even go there. We don't want to think about it. Um, but with this whole meaningful change series this year, our whole purpose of having this series with this particular topic is that we're all thinking it. We're most of us are thinking about it. It has been in our mind. It's this worry, right, that just keeps going. And so let's talk about it. Let's actually bring it forward. Let's talk about it and get more information, right? Because the more educated we are, the more we feel that autonomy and feel like we have a little bit of say and control. So, what we're going to talk about today is what is palliative care. We may have had different thoughts and feelings about it because we're unsure about what it means. But these two lovely ladies here today are going to talk a little bit about that. What does it actually mean? I'm assuming that you guys will have some personal experience that you'll share with us. And then I'll also kind of throw in some of my experience with palliative care with Stella as well. So Jennifer, I'll hand it over to you.
Okay, great. Let me get this share going again, and everybody excuse my crazy desktop while I get all set up. You get to see a little bit of my happy place in Italy.
Yes, that was lovely.
You're now seeing my screen, is that correct?
Yeah.
Yes.
So as you know, Casey said, we're going to talk about palliative care and hospice care and concurrent care a little bit and what they all mean so that you understand them. I think at Courageous Parents Network, we really strive hard to educate our parents about what things are, because I feel like when we know what something is actually, instead of what we sort of hear out in the world, we equip ourselves to be more prepared to cope with it. So we're going to talk a little bit about that today and all of those things. But I also wanted to say to you, the way that Maria and I are hoping to introduce this is to frame why palliative care might be a great addition into your life. And so we're going to talk a little bit about something called centering your good. And that might seem like it's not relevant to palliative care, but we'll swing around and get towards it. But to introduce ourselves, or reintroduce myself, and to introduce Maria, my parent champion, who's here with me tonight, we thought we'd just tell you a little bit about a challenge we did called the 6-word challenge. We did this as a team building exercise together. And what we were asked to do was to define our perspective on parenting our rare children, and perhaps some of the experiences that we hoped to bring to Courageous Parents Network, and specifically how that related to palliative care. Because at Courageous Parents Network, we are very, very, very huge advocates for early introduction of palliative care into the parent and family experience. So I'm going to let Maria sort of talk a little bit about her gorgeous son, Jacob, here in this photo, and what her 6-word challenge phrase was.
Great. Thank you, Jennifer, for that introduction. So my 6 words are: nobody should walk this journey alone. And so Jacob, who you can see in the picture, he lived with a mitochondrial disease for 10 beautiful years. He was medically complex. And with mitochondrial disease, it's typically the major organs that are impacted. And in the case of Jacob, it was his brain that was mainly impacted. So he lived with seizures. Maybe not his whole life, but I think from 9 months on, Jacob always had epilepsy and actually had subclinical seizures at all times. So his brain was buzzing. And then his lungs were also impacted. So, Casey, you mentioned the word medically fragile. I would put Jacob in that category too, in and out of the PICU, in and out of the ER. So we had a lot of respiratory infections and pneumonia that landed him in the hospital. And throughout his life, yes, he was medically complex and rare, but he had also a beautiful life, and he went to school, he had friends, our family and extended, I would say his tribe, or, our group or support group, really made a difference. And I have to say that I'm not sure this is an alone job. You need your people. You need the Acute Syndrome Foundation to help you. So that is what I feel really, really made a difference in my life, being Jacob's mom, that I had that support. And that's my introduction.
Mm. And I think Maria would concur that, palliative care was one of those
Yes.
systems and supports that were walking alongside her and helping
Yes.
her feel less alone in the journey.
Yes.
So my 6-word challenge, and I won't talk so much about my son Ben, because I think you all heard about him the last time, but he also had a progressively declining disease and was losing skills over time. But my 6-word challenge is that every parent wants for their child. We all want things for our children, regardless of what their condition is. Think if you have other children and your typical children, you want things for them. You want them to go to school and feel welcomed. You want them to have friends. You want them to have a good day. You want them to smile. You want them to know happiness. You want all of these things. You want your child to achieve regardless of what that looks like. And it can change over time. The achievement may look different. Well, it certainly looked different for Ben when he was 3 than when he was 14. But I still wanted him to achieve and to feel those things. You want your child to feel exhilaration, even if they can't ride a bike. And we can give those things to our children. That's the truth. The real truth is that we can give those things to our complex children. And so this phrase really encapsulates what it means to me to parent. And I can tell you with 100% assurity, my capacity to really make that come true for my son Benjamin happened when palliative care it grew when palliative care came into our experience, which did not happen until he was 14 years old. And so I thought this would be a great way to sort of tell you a little bit about who we are and who our children were, and then why palliative care was so important to doing something else that we talk about all the time at Courageous Parents Network, which is centering your good. And you guys know this if you were at the last session. I speak a lot about intentionality and really drawing awareness, self-awareness to the things that you are capable of doing as parents that are already within you. And one of those things is centering your good. So what do we mean when we say that at Courageous Parents Network? What we mean is thinking about and having an understanding of what a good day looks like for your child, for your family, for you as a parent. It might look like, your child went to school today with no issues. You didn't have to go pick them up early. It could be that there were more smiles than usual. It may be that your family got to actually participate in an activity all together, because we know sometimes that is a really difficult challenge. And the truth is that good days look different for each family. This is true of regular families without medically complex kids. And I think it's really important, I continue to say this, to remind yourselves. And the definition of a good day in our lives is most assuredly not a static thing. We are going to have to be in a place where we can redefine that over and over and over again because our children are changing. Again, true, as your children grow up, any child, parents have to adjust, but it is particularly big for us because, you know, the baseline of our child changes. But sometimes good days are also influenced by things like, you know, you got a new job, or there's other things that factor into a good day. A really big part about centering your good and understanding how to create this sort of overall well-being existence is to think about how we ourselves feel as parents. All parents wonder and worry about being a good parent to their child. All of us do. But the stakes are super, super, super high. And we know it, and we feel the pressure of it when our child has is medically complex. And sometimes they're even higher still when your child, like mine and like Maria's, can't actually tell us what their wishes and wants are. They can't themselves necessarily tell us what a good day means for them. And that comes with an incredible amount of responsibility as the parent, because we are always trying to be their interpreter. And that pressure can make it hard for us to see ourselves as being the best parent or the parent we want to be with our child. And so, but it is all part of centering the good of our lives. And it is an important thing to think about as we go forward. So I just want to say that this connection between good days and our impression of ourselves as parents is in fact a field of study. At Courageous Parents Network, we don't bring all of this information to you out of nowhere. We read the research. We try to tell you that you can feel good about what you're learning today and think about it with the knowledge that it is actually other people are also thinking about it too, because they want those good days for you. And the people and the researchers that are thinking about this are actually primarily palliative care trained people. So anyway, recognizing that how connected a parent's understanding of themselves as being a good parent is related to the health and well-being of the family. The parents, this team set out to do this research, and this is what it said, basically. Parents valued making informed and unselfish decisions in the best interest of their child. They wanted to always remain at their child's side, whatever definition that meant. Even those parents who perhaps chose to enroll their child in a residential facility, they still wanted that sensation of remaining by their child's side. Showing, and this is the big one, it actually placed #1 in the list, showing that the child is cherished and having the child know and understand that they feel cherished. Teaching the child to make good decisions if they themselves can participate. The original research was actually done with families whose children had cancer, so that was a component of the research. And helping the child experience a good life, whatever that might be, for the child and for the family. And so, you know, we come to this and to talk about palliative care around this concept of really centering your good and understanding what a good day looks like. And so I'm going to ask you for a minute, and we're going to go slow, and I want you to think, because I think it will really help the second part of this conversation, which will be a little more linear and technical as we explain things. But I really want you to think about a good day for your family. Like, try to think back and say, that was a good day for my child. And by extension, likely it was a good day for you as a parent and then for your family. Visualize it, you know, and you know this from my last session, try to think about the feelings that are coming along with that. What feelings come, both good and bad. Sometimes a good day can actually make you feel very sad because you recognize the difference, because you see that there's this good day and you embrace the happiness of it all, but it can also bring about that anticipatory grief that comes along with it. So we have to acknowledge those feelings. We have to think about, how do we feel as a parent on those days? What were the successes that you went, yay, you know? And again, I just say this, it's really important to be intentional. And I encourage that because it's hard to be intentional with when our lives are chaotic and uncertain, but taking a pause and doing things like this occasionally can help you center your good and recognize how well you are doing as a parent and how many good days your family may be experiencing. But I also want to say that centering your good and experiencing good days takes an arsenal of tools. We know this. Sometimes it takes a respite care worker or your nursing staff or the babysitter, or, you know, for your child to stay successfully at school. So when you're thinking about a good day, think about what tools you had on that day, what things were in place that made it helpful to have a good day, and what ones were maybe missing that might have helped you have an even better day. Doing all of this, I think, will help you understand how to center your good, and then maybe see how palliative care can be a piece that fits into the puzzle to help you do this as we explore the topic. So Maria?
Yeah. So palliative care helps parents feel that they're being good parents. So not just a good day, but that you are doing a good job. And also important for your medically complex child, but also if you have any other children. So I mentioned that Jacob, he lived with seizures. And we had a palliative care minded neurologist that followed him for most of his life. And it took us years, but we really worked very closely with her on Jacob's goals and finding a balance with treating his seizures, but not making him too sedated from the medications. And it is not always an easy thing to accomplish, especially if you have multiple kinds of seizures and you also change. So Jacob wasn't always static. So something worked for a while, and then we were dealing with a new type of seizure. But to have her, it was her, Dr. Collins, really understand that we had a bigger goal for Jacob than treating every seizure. We wanted Jacob to go to school. We wanted Jacob to use his speech device so he could communicate with us. We wanted Jacob to be with his sister. And if he was going to do those things, we could not treat every seizure. So that meant sometimes Jacob would stare off in the sky and he would have a seizure, and we would just say, okay, we know he's seizing, and then we went on with our day. And, you know, it sounds simple. It was not. There were times where I was counting seconds and minutes. Was this going to be a seizure that we still needed to treat? But to have a neurologist that was willing to look beyond her field of expertise and really look at our family goals really made us feel good parents, both for Jacob, but also for his sister, Sarah.
Yeah, I think Maria brought up a few good things that I will say that the introduction of palliative care into my own experience was not, it was when we were facing a difficult decision for my son, but my worry as the parent, the space where I felt like I wasn't being a good parent or didn't know how to be that parent, was in talking to my other children about the complexity of the decision and the reality that it would impact their lives as well. And that's when palliative care came in to our world. So this is what I mean about centering your whole family's good and the benefit of palliative care, because it isn't just medically directed at the one child. It is a family, it's a family affair, so to speak, if you know what I mean. So I want to give you guys a little bit of a definition about what palliative care is. And I want to leave a lot of room at the end of this for Maria and I to talk about all the different ways that impacted us in our lives. But I do feel like I need to talk to you about a few of the facts of palliative care. So it's actually a specialized form of medical care for people living with serious illness. It is a subspecialty, just like any other subspecialty within a hospital. And it is usually delivered by a clinician alongside the primary team. So if you are enrolled in complex care, it is highly likely that a palliative care clinician sits on the complex care team. They may not be seeing your child at this moment, though they probably should be. But it is a subspecialty that operates that way. It can also be delivered by a nurse, a social worker, a psychologist, and as Maria noted in her example, sometimes, and this is true because palliative care isn't available in every location and region of the country, you can get a very palliative aware minded physician. In Maria's case, it was a neurologist who's willing to speak to you and about your goals of care in the same way that a palliative care doctor may introduce. The reality is that palliative care is there for pain and symptom management. And we'll talk a little bit more about what that means, because I think where all our brains go is physical pain management, and that is what they do, but it goes much more beyond that. I also want to say here that palliative care is appropriate at any age and at any stage of a serious illness. And we'll talk about that a little bit more in a minute, but and this is a big and, because I think this is the part that makes many people sort of back away when it first gets talked about, is that it can be provided alongside curative treatment. It is, see this image of the parent sitting there thinking they have to choose one or the other. And then you go to the other side and you can actually walk through both doors and get them both simultaneously. This is the gold that is palliative care. And this is the gold that helps us center our good and feel like we are being good parents. And that helps us redefine what that looks like every day as our child's conditions changes over time. So, like I said, palliative care is really about the whole child, the whole family, and it's really about living well for as long as possible under whatever definition that that is in your family. And you can see some of the bullets I have here also, that it facilitates agency and intentionality in uncertainty. And we talked a lot about that in the last session around decision making and having a space where somebody in the medical situation creates agency for you as a parent to feel and know that you are the expert on your child, to feel and know and have the backup of that from a medical professional. So this is some of the roles of what palliative care does. I thought we'd just show this quick video that might actually talk better than me, but we'll see. And all of you, oh, you know what? Let me say a few more things about palliative care first. Sorry about this, people. The other things I want to say before we introduce Nikki, who you met in my last session. I tried to use the same parent again, so you didn't have to learn the background. The other great thing that palliative care can do is, and we talked about this a little bit with agency, is be a liaison between other clinicians, right? Palliative care providers are gifted communicators. They answer any question a family has. Sometimes doctors talk better to other doctors. So having one on your team can be very helpful because they can be an interpreter when you need to have that. They can also do things like help you define your goals of care for your child and then vocalize those goals to other specialists. And I'll give you an example from my own life, which is my son Benjamin developed impacted tooth. My Dentists did not feel like they could cope with that. He was too medically challenged at the time, and she sent us to the ER. The first phone call that I made upon leaving my dentist's office was to my palliative care doctor. She was at the hospital when I got there. She had already explained to the ER physicians what was wrong with my child, so I did not have to tell them about his diagnosis. She had already explained to them that one of my goals of care was not to intubate my child, and so they were going to have to find a way to treat this impacted tooth without him having to go under general anesthesia. And the ball was already rolling for me. And so I got to go into that ER and be Ben's mother. I didn't have to go into that ER and be, that driving advocate that has to sort of be the go-between between doctors. And I didn't have the burden of explaining all of those things. And you can see that improved my definition of myself as a parent. It's really important how palliative care talks about these things and helps you develop your goals of care. So let's listen now to the video and hear what Nikki has to say.
It was like this secret society, because the story is just ever changing of decision making and heartbreak. And I'd say the biggest role that they play for us is that, the biggest thing I want for my boys is comfort. And I said early on to Janet, and, she'll say that is, I want Avery only has 2 good days a week, and I want Avery to have 5 good days a week, at least, that I want to be able to see a smile. And they gave that to me. We worked for 2 or 3 long years to have this cranky baby, and he was cranky and, screaming so much that his toes would curl, and it was just horrendous. And to this baby that, not a baby, becomes a boy that has that smile, and we got that 5 days a week. But it was me, back and forth with home visits and them coming in and let's adjust this med and let's go back and forth with this. And a lot of these doctors were afraid. They wouldn't touch the meds. I still have doctors to this day saying, does he really need the methadone? I say, you're not touching that methadone. You're not touching anything, because this was a work in progress that we perfected to give this little boy a quality of life. So it's the quality of life and having somebody that listens to you, that really knows. I mean, it's the most basic thing of a child, is to be able to protect them and to take away pain. And to have a doctor listen and not be worried about medication. And if that's what they need, that's just what they need. So it's just knowing that you have this team to give your children a quality of life that they deserve. Can't say it any better, in the decisions and walking you through that. And so I know every time I have a difficult decision to make, I've got them on speed dial, and I can say, okay, it's this time. I'm having anxiety about this. That I know that they're going to be there for us. It's just having a second family, really.
Yeah, so you heard, and I'm hoping that the video won't play again. You heard, is it going to play again?
I think you're good.
Okay. You heard Nikki talk about the pain and symptom management component of palliative care and how important that was in her thing. But I hope what you also heard was that Janet, who was her palliative care nurse practitioner, actually, she listened to what the goals of care of Nikki were, what she wanted. Janet and Nikki talked about things like, how can we make more good days? How can I express these worries I have about my child? How can I, they do things like talk to your other kids and your marriage. And you heard her say, the biggest thing was, how can I make these decisions with my child and feel good about the ones that I'm making?
Great. So let's talk a little bit more about how the palliative care team can help you. So the palliative care providers, they really understand that parents know their child best. And they can really be a sounding board to explore different options and different viewpoints, and both consider the benefits and the possible burdens. And they can help you to always decide, or help you to decide what is most important given both your child's conditions and back to your family goals. And then important too is they might also help you to revisit goals or reconsider interventions as circumstances change. And ultimately, this can help you to feel more confident and minimize any future regrets. And I'm going to give you 2 examples where palliative care helped our family. So Jacob's ear, nose, and throat doctor, he proposed quite early on in his life that Jacob needed a trach. And we thought when a doctor was proposing something that we had to do it. So we were like, yep, okay, we need to do the surgery. And Jacob's primary care physician, she was probably our biggest palliative care minded promoter on all of Jacob's team. She said, time out. Let's sit down and talk. What are your family goals? And she also said something very important to us. Don't forget that mitochondrial disease is a progressive disease. So Jacob will stop breathing one day, but the vent will keep him alive. And so she actually took us even to that, and for us to consider that we would have to actually turn off the vent if we trached him. And again, not a straightforward decision. It wasn't made in one meeting. In fact, I think I struggled more with this decision than my husband, and I sort of revisited it over and over again. In the end, Jacob never was trached. He never had a vent. And now I am so at peace with the decision, because one of the most important things, and it sounds maybe like a little thing, but we could always take Jacob to our neighborhood pool in the summer. We did not have to think about disconnecting him to a vent. We didn't have to think about how do we keep, his safe. We could just put him in the pool. And when I say just, he was medically fragile. So it was still a little bit of an affair to get him in the pool. But until his last weekend of his life, he actually was enjoying the pool. And because Jacob loved water, he couldn't walk. And so the water gave him a freedom that he just didn't have anywhere else. So, there again, I can't thank, his doctor for stopping us and really thinking more, what is your goal rather than always one intervention after the next. My other example is going to talk about seizures. So I live in Colorado. So we have CBD available legally in Colorado. And many families actually moved to Colorado when this became legal, because it, treated seizures in several kids. In Jacob's case, it actually didn't help his seizures, but he had myoclonus. So he had involuntary movements of his hands and his feet. And, that CBD actually stopped completely. And why is that important? Well, Jacob was able to use a speech device, and he activated the speech device with his right foot. And when he had myoclonus, it was very frustrating for him because of the involuntary movement. He picked, options on the talker that wasn't what he wanted to say. So when we were able to stop the myoclonus, he could actually communicate with us. And due to him being medically fragile, we wanted to let his medical team know that we were going to use CBD. We didn't want to hide it. We wanted it in his chart, and we wanted to sort of make that a joint decision. And Jacob's primary care physician, she is a little old school, and this was not what she would have recommended. But when she understood that the reason we were interested in this and we were willing to try it, even if we didn't know of all side effects because it was still fairly new, we wanted Jacob to talk. We wanted Jacob to have a voice. We wanted Jacob to have a voice in school. We wanted him to boss us around at home and, be a kid. So that was a big win for us, that we were actually able to convince his old school, fantastic primary care physician to have us try this. And we probably would have done it no matter what, but to know that we had her support really, really came a long way, and that we really, really felt heard and recognized that we knew our child best. We really knew Jacob the best, and what his goals are, or were, I should say.
When I'm just listening to both of you talk
Yeah.
and look at these bullet points, the sounding board to explore care options, like that right there has been so incredibly important when we talked to Stella's palliative care team. And it's really it comes and goes too. I don't know if you guys had the same experience, to where sometimes we were really heavily leaning on the palliative care team, and then other times we're like, nah, we're good, we're just hanging out, and they would pop in if Stella's hospitalized. But then something would happen and we're like, okay, we really need to have that sounding board. And so how I thought of it too is like, they were the ones that were able to break down those silos. And so Stella has many specialists. And so the orthopedic surgeon thinks this needs to be done, but this particular, specialist thinks this needs to be done. And sometimes they don't realize how much one affects the other, right? Like, okay, yeah, we need to have our hips fixed, but what's that going to do to seizures and pulmonary? And so the palliative care team can really step back, and they can really help kind of marry all of those specialists together. And if the particular specialist you're talking to isn't getting it, then they can use their doctor words and really kind of get them on the same page. And that has helped me a lot, even with the anticipatory regret or that decision fatigue, because I do have someone, a whole team, that we can really talk about that. And especially like, me and my husband might be on different pages, but after we have a conversation and his worries are brought forward, my worries are brought forward, and we can address both of them. That has been, I'm like, as I'm talking about this, I'm like, I feel like the palliative care team is kind of like a therapist.
You've got a lot of it. They are excellent interpreters. They are excellent listeners. They are a conduit between specialties. And I mean, most of us have experienced this, where a specialist is only seeing the body system is their specialty. They're not putting the whole child in front of you. And as a parent, again, part of feeling like you're being a good parent is having somebody who sees your whole child, every part of it, the good, bad, the ugly, the beautiful, and how they're all interrelated. And palliative care really is, they are trained to actually think in those manners, and as you said, Casey, to be a sounding board so that what comes through is your center, not the medical community's good. So, and I, again, because my decision making is a big thing for me, I think the role that palliative care can play in making sure that we minimize decisional regret is huge, because they can remind you why you made a certain decision at a certain time, and the steps that you took, the due diligence you did as a parent when you made that decision, so that even if the outcome isn't the one that you had hoped for, you can be reminded that you made it with your best intention, that all the best information that you could compile to make the decision. And I think that we need that. We all need that in our voice. It's one of the reasons why we come together in our disease communities, is so that sometimes we can have that reassuring voice that reminds us of where we've been and why we made certain decisions. And that is a big one. So just playing off our last session with decision making. I thought I would play this video now for you. It is, it's actually, I'm playing it for three reasons, really. The one is that it's actually a pediatrician. He went on to become trained in palliative medicine, but it wasn't his original specialty. He was the founder of Courageous Parents Network's daughter's pediatrician. At the time, he was not a palliative care provider, but she will tell you that she got palliative aware practice. And so again, I just want to highlight that your champion may be somewhere else. It may not be in the palliative, you may not have access to a palliative care department, but you can find a palliative aware person. Casey, you talked about this, and also Maria in her examples is internally, I also, as you're listening to what he says, I want you to think about your own internal palliative voice and how you're building that muscle inside of you. And sometimes what the best benefit of palliative care is, they are like your trainer. They're helping you build that muscle so that when you really need it in those moments that are so critical, your muscle is strong and your internal voice is meaty and good. So let me just let Rick talk to you about this.
But the first thing I'd want them to know is that this is not the end of hope. This is the beginning of finding your way. And that's what I'd like them to understand, that our mission is. At the very least, we try to support and problem solve people so that in these set of circumstances, there might be resources available that they're not so aware of. There may be phone calls that we can make or forms that we can fill out that will help them in a small, concrete, good way. In what I think of are better conditions, we can also really help clarify, we can help advocate, and we can also walk alongside of you and or the families for as long as they need us, and in whatever way they need us, so that they have somebody that they can turn to that is not involved in the bedside decisions on a day-to-day basis, who is invested in helping them understand the big picture, and someone who's worked to understand what they're hoping to achieve in these things, to participate, an informed voice that's sympathetic and advocating of the broader ambitions of a family. We also introduced this attention to suffering, which is a real part of what we think about and try to reduce. And I suppose in that way, there's an important distinction. So a liver doesn't suffer and a lung doesn't suffer, but a person suffers and families suffer. And we think that that's really important in the care of a child. And we work with the subspecialists to make sure that that gets attention as well.
I'm having so much technical difficulties today. Sorry about that. So I love Dr. Goldstein and the way he talks about finding your way. And we're going to talk in a minute about hospice care, because that is also really about finding your way at a different stage in a different place. But it is really about finding your way. And I also just want to highlight something that I spoke a lot about in the decision-making webinar, is that remembering that we make decisions in two places. We make them in our heads and we make them in our hearts. And when Dr. Goldstein comes and says he wants to remember and acknowledge that families are suffering, he's acknowledging both the physical pain and suffering, but also the suffering that goes on in here. And this is a real benefit of palliative care. It is also very much true of hospice care. And because it is about, as I said, finding your way. It's just finding your way at a different stage. And, you know, we're all coping with changes in baseline of our child. And we all hope that we're never going to get to that one change. But it's important to understand how the two work together and to understand their differences, because our world is set up in a way that there are very practical differences between the two things in some respects. And then in other places where palliative care might not be available, it may be suggested that your child enrolls in hospice care because that's the way you're going to get access to some of the services that are offered and might not be available otherwise. So it's really important to sort of think about the two differences. So let's just, you know, hospice care is really an extension of palliative care because the philosophies remain the same. It just focuses on more on end of life, not always. To qualify for insurance coverage, and this is where the distinction gets slightly different, a physician has to certify that the person, in our case, as we're talking about pediatrics, the child will die likely within the next 6 months. Now, this has become very fluid, and there are children, especially in certain regions where, again, palliative care might not have access to a team, can be enrolled in hospice for long periods of time. Also, and this little diagram is here with all those little swirly squiggles, because it is the case with our children that they can have what looks like a very declining baseline and then plateau and spend a long time in that plateau. And so during that period of decline, it may be suggested that hospice come in. And again, sometimes that's suggested so that you can get additional support mechanisms. But they can float back out again and hopefully have a palliative minded physician that's also following them. And so that's where the gray space comes in, and people get scared because it's end of life. Mm-hmm. And yes, that is true. That's really the time period when hospice is likely to be activated, but it is not always an indicator, I guess is what I would say to you. Hospice care is delivered through a specialized interdisciplinary team of professionals, and it often includes volunteers, which is a distinction that you also need to understand. So you may get somebody who just comes in to play with your child or fulfills a more volunteer role. But importantly, it gives you access to nurses on call for 24 hours a day. This is a big distinction, so that if you have a medical emergency, you have a nurse that you know you can call. They don't stay in your house 24 hours a day, which we all know, I know sometimes wish we had one of those. But that is a distinction between it and the opportunities that palliative care would often not have available. Hospice, when your child is enrolled in hospice, they often pay for and secure medication, equipment that you might not be thinking about, bring them to the home. So, you know, your durable medical equipment or anything related to that can be covered and managed by hospice. There's no age restriction to hospice, and it should be accessible at any age. However, as I said, unfortunately, our world isn't accurately, or accurate isn't the right word, isn't always user-friendly. And so I want to acknowledge importantly here that there aren't always pediatric hospice programs available to families. And it's an important distinction because we are required to provide that benefit to everyone, but sometimes the provider isn't always as skilled in our pediatric arena, and you may end up with a hospice provider who really has only experience with adults. And it's, you know, we know this because we're the parents, it looks very different. So I think it's important for me to mention that out loud because it could be the reality of what you experience. So I want to go back also to that slide, and this is sort of a misconception around hospice care, that it just means the end and the end is coming and everybody's given up and we don't have anywhere else to go. That is not true. Because if you'll go back to that slide, that little drawing of the mom walking through the two doors, there was actually during the Obama administration a law enacted that said concurrent care treatment can still go along, life prolonging treatment can still go along, even if a child is enrolled, and that's an important distinction in hospice. So it is not an either or. It's not I'm here and I'm giving up, or the medical community is giving up. It's I'm here and I need more support to be the best parent I can, and for my child to have the best days they can for as many as they can. So I think, again, just like palliative care, it's important to dismiss that. And again, they're going to be there to be that sounding board that says, and hopefully you've had a palliative care team or a physician that's had some of these conversations with you earlier. What do you want certain things to look like? What don't you want? I thought I wanted my son to be home when he passed away. He happened to be in the hospital. But I had the chance to have those conversations ahead of time with somebody. And they can talk about all of those things with you as you're going. And importantly, you still get a lot of you get the extra volunteers during hospice, you get the access to the nurse. So there are distinctions, but they can be and should be delivered seamlessly and without it feeling so big of a transition to you as a family. But the reality is our medical system and our insurance system, unfortunately, doesn't always accomplish that in the way that we need it. So I've gone through some of what's on this slide, but it really, palliative care and access to it really depends on where you live. It's unfortunate. The way that families have often asked us, how do I get to a palliative care doctor? Because it does require a referral. It's an insurance issue. It will require a referral. So it's most common for families to get a referral when they're inpatient in the hospital. But that is not always the case. When my palliative care referral came, I was actually at my GI doctor talking to him about the fact that my son might need to get a feeding tube if we were to have spinal fusion surgery. And I expressed to him again, I said, I'm worried about how do I talk about all of this with my children? And he said, oh, you need a palliative care doctor. And I was just at a regular visit. I wasn't an inpatient. It was just my regular visit. I also want to say is you don't need a doctor to make a referral. You can ask. My child has serious medical complications. I need this kind of support. And you can ask your pediatrician or whoever it is that you feel comfortable with. It's important to know that in some places, palliative care is only available in a hospital situation. In other areas, there are community-based palliative care organizations. For myself, my son experienced palliative care through a hospital because I live in Boston and I live very close to the major medical institutions. And so they would come to my house, the palliative care team. But sometimes community-based palliative care teams can involve things like a child life specialist will come to your house, a massage therapist will come to your house. There's a whole host of other care aspects of your family experience and what will help you ground and center your good that can come through a palliative care referral. And I listed here states that have some of the strongest palliative care state benefits, just because we keep track of that at Courageous Parents Network. So maybe Casey, I'd love to hear, how did you get a palliative care?
Yeah, so so Stella was born in late of 2015, and by 2016 she had already been hospitalized and had numerous specialists, and her neurologist said, I think you guys would really benefit from a palliative care, visit with the team. I said, okay, but what does that mean? So I kept asking like different people when we would be hospitalized, what does that mean? Oh, well, they just talked about, Stella and your family. And I'm thinking, gosh, is this just one more appointment? Just one more thing I have to add to my plate? Like, I don't understand the goal, the purpose of this. I was pretty like, no, we're not going to do this. I'm not going to add one more thing. And we live far away. So it's like a whole nother drive up there. And so finally someone's like, just make it at the same time as some other appointments. Give it a chance. I'm like, okay, fine. And we walked in and I thought, oh, we should have done this sooner. And one of the first things they asked when we walked in was, what is your biggest fear? And I was like, ooh, she was like, what's keeping you up at night? What is that little worry that you're like, oh, what do I do if this happens? And at that moment, we did not have any type of monitoring for Stella. And we thought my biggest fear was if I woke up and I went to her crib and she was not living any longer, that she had passed. And I was so fearful of that. And then what do I do? What do I do with my son? And how do we go about doing that? And what does that look like? And I said, I don't want it to be chaotic. I don't want people coming in and giving her CPR when we know that she's passed. I want to hold her and I wanted to cuddle with her and I wanted it to be a calm environment where my son would have time to hug his sister one last time and all those things. And that's when they said, have you heard about an outpatient DNR? And I said, no, I've never even heard of that before. And they said, well, if you have this this form and something like that did happen, then you would pull out that form and you could spend however much time you want with Stella. And when you're ready for some help, for someone to come in, then you would call, but then you would hand them this form. They're not going to do CPR. They're not going to do all those things that you're talking about. And she said, no one even has to know that you have it. You just we kept it in her diaper bag. We still do. And if we have to use it, okay. If we don't, that's okay too. But it's our decision, right? If we feel like there's a chance that she might be revived and we want that for her, then we don't use it. But it gave us that autonomy. It gave us that a little bit of control out of this very uncontrollable event. And that fear was still there, obviously, of losing our child, but it was no longer the fear of what do we do if this happens, because we then had a little bit more control over that.
Yeah, I think that is a great example of how palliative care helped to equip you to be the best parent you could should you encounter that situation. And that's really what they were trying to do, because they uniquely understand that at the end of the day, that's what will remain with you. So I know we're bumping up against time. And so I want to leave enough time in case somebody wants to ask a question, but I hope you heard in not only what we learned today, but also, especially in the examples that Maria and Casey gave, that palliative care can be a critical resource as you're advocating for your child. It really puts you in a place of authority, and it really puts you in a place to equip you. They provide consistency. As Casey said, they took away some of that uncertainty that she had around that worry. And that made a big difference for you. I think it's still making a big difference for you. And so I just want to leave you with this poem that returns us back to that concept of having felt like you've been a good parent to your child and centering your good. Because what it does when I read this is it reminds me to think about the times when my son felt beloved, the things I did to make him feel that way, and the things that he did in return to make me feel that way. And ultimately, that goal is the goal of palliative and hospice care. It's the same thing. They're just a tool in your toolbox that are going to help you make sure and ensure that this is the reality. This poem comes true in our lives, regardless of what that outcome looks like, and that we feel like we have been good parents to our children. So those of you, we should go through a few resources that we do have on Courageous Parents Network, and then we'll open it up to some questions.
I will be super quick looking at the time. I know some of you also attended the previous session with Jennifer, but do take time to look at Courageous Parents Network. It's a digital resource. And I would say the topic of palliative care is fused throughout the whole website. But at the same time, it really gives you objective tools to look at, for example, interventions, and you can get pros and cons. And you can curate your experience by either following a specific family, a specific topic, or a specific diagnosis. So there are many, many entry points throughout the whole educational resource. And then you can also print guides. We have the blog that is also popular. And then we also have monthly in the room where you can sign up, and it is a speaker who will talk, a variety of topics. And that can also be a little bit more interactive if you're looking for that. So check us out and give us feedback.
Yeah, and these are just some of the resources that we do have that talk a little bit more about palliative care and hospice care. It's hard to cover everything in 1 hour, to be honest with you, all the components of it. So go in and explore, and again, find the parent that resonates with you of the many parents featured on our website. So and I just want to say one last time, I know I said it the last time, I think this holds true. Marie and I are now tools in your toolbox. By way of this webinar, we have been introduced. These are our email addresses. You can always follow up with us in any way, shape, or form. So let me stop sharing now, and we'll open it up to any questions that anybody has.
One thing I wanted to mention too was what I felt very comfortable, that there was no judgment in the room when I was with palliative care. Like anything that I was worried about or was hesitant to say to anyone else, even, a really good friend, I felt comfortable talking to them about those things, because they're not going to be like, ooh, did she just say that? Everything is open and on the table, and no judgment.
Because they understand you're the expert on your child, and they understand that you have the capacity to develop goals, and those goals need to be respected and listened to. And there isn't a right or in the real reality in this. And we talked about this in the decision making. There's often no one decision that can be made. It's often very personal. And sometimes it is, yes, your child broke their leg and they need a cast. And there's not really a decision to make. But in the lives that we live, it's unique where that situation comes about. It's mostly that the right decision is the one that works for your individual family.
Yes. I'm checking on the chat here. I'm not seeing any questions popping up at this point, but no questions. Great talk. Thank you, Michelle. And like I said, if in what you mentioned too, you guys have your email address now. And then, they can always go through me too, and I can forward them your way as well. And I can't say enough good things about your app, because what I love about the app too is that you can access it at any time. If you wake up at 2 a.m. in the morning, you can't go to sleep, if something's on your mind, you can jump on there. If you're in the hospital bedside, any of those things. I think it's important that, parents can use it when they need it.
Yeah.
Deanelli, yes.
Yeah, I'm happy to.
Yeah, that's awesome.
I think it's important to just keep
Yeah.
the ways that palliative care has been amazing for your family. Sometimes it's very simple, small things, but sometimes those small things, really can make a huge difference. As I gave the example about the tooth and just showing up and having the whole system sort of being used for me.
Yeah.
I wrote that down, and I was like, what a relief. Like, I literally felt myself go, for you, that you didn't have to be like with your boxing gloves on, ready to advocate. Like, you got to just be able to come in and be his mom. And so that was, yeah, that was very impactful for me to hear you say that.
Well, you'll all have, if you attend the last session in the Meaningful series, you'll have an opportunity to meet Blythe Lord, who's our founder, and that was her pediatrician, Dr. Goldstein, who was in the video, but also you'll have an opportunity to meet Dr. Pat O'Malley, who happened to be my palliative care doctor. And I think you will understand why at 14, when she finally came into my life, I was like, where were you? And I really needed this, because I really believe that we can demystify the fear of this if we introduce the concept of it earlier. And also, as I said, internally, you're developing those voices for yourself, and they reinforce that. And we all need a champion sort of cheering us on in the background as we're doing this job.
Yes, 100%.
Yeah.
And so, yeah, we will get to meet both of them on June 10th, which is a Monday. And I do not have the time in front of me. So I have it all on our website and everything else. But if I say the wrong time, I don't want to confuse anybody. So I will make sure to post it on our Facebook page, and we'll be sharing over the next week to make sure everybody gets to the right place at the right time. But thank you guys so much. We really, really appreciate this. And we appreciate Courageous Parents Network to collaborate with us. And we also greatly appreciate our sponsors. We have our platinum level sponsor, Neuroquin Biosciences, and our gold sponsor, Praxis Precision Medicine. So thank you, ladies, so much.
Thank you.
And thank you so much.
Appreciate it.
Thanks
Have
to
a
everybody.
great evening.
Thank you, everyone.
Bye-bye.
Bye.